recognize Dr. Vaughn for 5 minutes. Please start your
Thank you, Chairman Massey and Ranking Member Correa. I'm Jordan Vaughn. I'm an internist in Birmingham, Alabama. And as an outpatient clinician, 2020 presented a broad set of challenges, specifically as an employer of around 200 healthcare workers and responsible for approximately 150,000 patients. My company had to set out and do the right thing. And as a community, we solved the problems of a lot of things in regards to how to take care of people with COVID, doing things like test and then getting them monoclonal antibodies immediately upon testing positive that they met criteria, to the number of about 10,000 monoclonal doses, all the way to making sure that the regular care of my patients was taken care of on a daily basis for patients with diabetes and other such things. This task required me to spend a lot of time learning a lot about what was the pathogen. And it was in this reading that an understanding of kind of SARS-CoV-2 and specifically the spike protein emerged, an understanding that seemed to counter the emerging solutions from the experts in the federal agency, pharmaceutical companies, and academic medicine. Based on my reading and clinical experience, what made COVID-19 especially unique and deadly was the spike protein. Spike protein, specifically the S1 subunit of this protein, is pathogenic. It's immunotoxic, it's cytotoxic, it's coagulopathic, it's amyloidogenic. It's every word you probably don't want to be associated with whatever disease somebody tells you about. The proposed solution was a novel mechanism of injecting lipid-nanoparticle-coated modified messenger RNA that encoded for a stabilized form of this very thing. And that at first worried me, mainly because of the people that actually had already had COVID. So at that point, I felt that one of the things that I did was actually I had probably one of the largest reference labs there in the outpatient setting, and I had a machine that actually told me who actually was seropositive for COVID before a vaccine was given. But as I started to give the vaccine, I started to notice that some of my patients had some interesting side effects. My first encounter was a 69-year-old patient of mine who'd been my patient for about 10 years. He developed a significant short of breath, elevated BNP, elevated D-dimer, and as much as I wanted to think he had a pulmonary embolism, he didn't based on the CT scan that was done. Instead, again, driving me back into the research that was available thanks to the National Library of Medicine, I was able to find out that the coagulopathic effects of the spike protein can cause something like this, started him on anticoagulants and antiplatelets, and was able to get him better, which was kind of started my journey. Though often called long COVID, is the other thing I want to talk about. It's really the devastating effects of the spike protein to multiple systems, and it's changing the landscape of a lot of the medical disciplines. The cardiologists are seeing it, the neurologists are seeing it. They really don't know what to do with it. Since 2022, after my early encounter with the unique vascular and coagulation issues with the spike protein, I have seen over about 2,000 unique patients. All of them have sequelae from a COVID-19 injection, a SARS-CoV-2 infection, or unfortunately, most often both. Especially in those with vaccine injury, their faith in medicine and public health is shattered. Many of those patients were holdouts from getting vaccinated because they knew their own immune system sensitivities or they had already had an infection of COVID. One of the ways that I had actually pointed it out to them because I actually had the serum samples that could prove their antibody evidence. However, it was under the August 2021 military service member, federal employee, and OSHA mandate that these individuals faced a decision to either vaccinate against their conscience and common sense or lose a career and gainful employment. Disabled from the adverse effects of these mandated injections, the profession they once held dear is an afterthought to just hoping to a diagnosis and possible treatment. Among the most egregious is kind of our service members needlessly harmed. Actually, my nurse practitioner, her husband is in the military, went to West Point. And so we have a very good connection with the military in Birmingham. And the amount of young individuals that following the injection had significant issues like shortness of breath, myocarditis, or basically are now being medically discharged because they're unable to complete their physical requirements in the military is fairly devastating. At least in my clinic, it's 30 individuals. My main area of clinical expertise happens to be on the coagulation effects. I actually was able to reach out and meet Risa Pretorius and Doug Kell, and actually am able to look at what the spike protein can do to plasma, causing fibrin to aggregate, and aggregate in a way that makes it very hard to break down. And it causes a lot of issues that are difficult for physicians to look at, is because the small vessels are usually where it's affected. It's not the big vessels that we target. So it's really the federal regulatory bodies, including the FDA, that we task this to be forthright, unbiased, and responsive to the efficacy and evolving evidence of risk and consequence. A watchdog and overseer of the pharmaceutical industry Instead, the FDA's director of CBER advertised and advocated on YouTube for a product they were tasked with regulating and overseeing. I thought that was inappropriate because in the same way, informed consent is the foundation of the patient-physician relationship. And absent this information forthcoming, that relationship's irreparably harmed. So when we talk about vaccine hesitancy, a lot of it is just the relationship between the physician and the doctor has now been broken. So in closing, I often think back to something I read a few years ago about following science. Over the past few years, we've heard media, public health officials, and politicians use the phrase follow the science. The problem with following the science is that science does not lead anywhere. Science is an observer, measurer, and descriptor, not a leader. Individuals lead. Pressing science to lead is a way decision makers avoid accountability for choices they make on the public's behalf. The leader is appealing to the authority of science to decide a course of action to conveniently sidestep accountability in the event of failure. I implore my physicians and scientists to not follow the science, but lead humbly with science for the good of our patients.
Dr. Vaughn,
Thank you,
agree?
Dr. Vaughn.
I agree. I think, again, they were told one thing, and then most people, once the opposite happens, usually start to question whoever told them that.
Exactly. And why do you think, well, let me ask it this way. We had someone earlier say that, I think Dr. Pavia said this. He said the way it should be determined is patients and their doctors should decide how this works. But this thing got so political that you couldn't even do that, could you? You treated, I think you said 2,000 patients in your practice, and someone just asked you a number, how many people took the vaccine and died? And you said, I can't give you a number, but you give 6 examples of people who had huge complications in your written testimony. So tell me about that relationship and how politics played into the relationship that's supposed to exist between the doctor and their patient.
Yeah, I think the biggest trust was lost when they were mandated to get something against their conscience. And I think that is one of the things that needs to be, especially when you talk about a physician that knows his patient. There are certain patients that don't need to have their immune system, in a sense, poked. And I think most physicians would agree with that. But that knowledge is what a physician and their patient have in the relationship that exists. It is not something that is found in a parking lot when you roll down your window.
Did you ever feel pressure from any government entity, certifying board or whatever in the way you were treating your patients?
I did not. Interestingly enough, I got, some other physicians decided that when I was saying that the vaccine did not necessarily prevent transmission, they wrote the Board of Medicine. I went down and had a discussion, but at that time it was proven that I was correct. If that makes sense, it was at that time.
Some of your colleagues tattletaled on you.
Yeah. People I had never met, other physicians. The other thing was, and again, this is my 5-year-old. Who basically
sit you in front of the board, and you happen to be right.
Yeah, going to kindergarten, I spoke in front of the board about masking my kindergartner. Again, my wife being a speech pathologist, masking children for 18 months didn't really help with their speech development, their ability to talk, and I also was turned in for that as well. Again, I asked the Attorney General of our state if I had given up my free speech when I became a physician. He told me I had not, but evidently that is not true.
Yeah, I mean, the cause of vaccine hesitancy, the reason this got so political, in my judgment, is because our government told us time and time again things that were not accurate. They told us, I said this in my opening statement, they told us masks work. They told us 6-foot social distancing, which meant we had to close schools and shut down businesses and restaurants. They told us that was based on science. They told us the vaccinated couldn't get it. They told us the vaccinated couldn't transmit it. They told us it wasn't with the lab. They told us all kinds of things that weren't true about where this thing came from in the lab. And then maybe the biggest one, first virus in human history where there's no natural immunity. Is that true, Dr. Vaughn? Is there natural immunity for this virus like every other virus?
I will tell you, again, I was early in actually having basically an immunoassay that would tell me among all my patients who had COVID, and there's about 7,000 people that I had that database on. And up until Omicron, the reinfection rate among my people that were seropositive was basically 0. Yeah, I think, again, a lot of what I have is just anecdotal stuff that we're continuing to do. But again, it's anecdotal on 2,000 people. It is an interesting thing to find out how hormones affect different things in regards to what the vessel can do. The other thing that we've seen to find is a lot of the patients with hypermobility are more likely to have, postural orthostatic tachycardia syndrome afterwards. And I think, again, that has to do with the vasculature being harmed by the spike protein in people that already have some vascular pliability.
Very good.
Certainly wasn't science.
Representative Massey, I
Yes,
think
Dr. Vaughn.
at the end of my testimony, the problem with following the science is that it's not a leader, it's a meanderer. And you will come to all kinds of conclusions if the science is guiding, but the leader is basically not having any accountability for how stupid his decision might be. And instead, it's leaders that make decisions, and they have to be informed by the science, but they also have to balance it against other benefits or risks.
Dr. Vaughn, I want to ask you a question. You said you treat long COVID and you treat vaccine injuries, and you've seen the same sort of things you think a lot of it's caused from the spike protein, which you described. Has the government made it easier or harder to differentiate between those two conditions? Or haven't they confounded this issue by putting the data together and making no effort to distinguish between long COVID and a vaccine side effect?
I would say a lot of the people that I see, I mean, I do a very robust inventory, mainly because I want to collect the data. And so I had to add to a lot of the long COVID questionnaires, did you receive the vaccine? Did you have any side effects from the vaccine? And did the vaccine make your symptoms better or worse? And I think that's an important discussion, but I will say there's plenty of people that fill out my list and say, the vaccine is what caused my symptoms. The day I got the vaccine, that's when I had the symptoms that I have. Now, they've had COVID since, but I do think disambiguating all of that is a very important thing because I think it's an important distinction.
Experiencing vaccine injuries, I'm curious to know if you've had patients express concerns with the CICP.
Absolutely. I think most of them are in some ways, they're already devastated. And then to have no help and then find out that even the help that was set up in the 80s is not even what they can access is quite surprising to them.
Have you had any experience with helping patients to navigate the CICP, and can you elaborate on your experiences as a doctor helping these patients?
Mainly it's just getting the documentation of what I see as well as the lab abnormalities and just basically filling out and fulling up what actually went on so they have a legitimate case.
Do you think the fact that the COVID vaccines are under the CICP fueled or contributed to vaccine hesitancy during the pandemic?
Honestly, I don't think anybody knew.
Okay.